Welcome to the recorded version of the Grantmakers and Aging web seminar, Elder Economic Disparity, The Problem and Workable Approaches, featuring Ramsey Alwin, Director of Thought Leadership and Financial Resilience with AARP, Roslyn Quarto, Executive Director, Empowering and Strengthening Ohio's People, Naomi Stanhouse, Program Consultant, the Retirement Research Foundation, and John Feather, CEO of Grantmakers and Aging. From April 22, 2016. This event was made possible by a partnership between Grantmakers and Aging, the John A. Hartford Foundation, the Retirement Research Foundation, AARP, and Empowering and Strengthening Ohio's People. Technical and production support is provided by the American Society on Aging.
Well, thanks so much, Steve, and thank you to all of you that have joined us today. We're delighted that so many of you have taken this opportunity to learn about this important topic. Before we begin, we want to thank the John A. Hartford Foundation, whose continuing support allows us to provide this webinar free of charge for our audience. We also want to thank today's co-sponsors, the Retirement Research Foundation, AARP, and Empowering and Strengthening Ohio's People. We also want to thank Ellen Bruce, a consultant for GIA, who was instrumental in putting this session together, and to our partners at the American Society on Aging, who provide us with our wonderful technical support. Economic insecurity is a very real problem for many older adults who lack the money to have decent housing, affordable health care, food, and transportation. This economic insecurity can lead to homelessness, poor health, social isolation, malnutrition, and shorter lifespans. This webinar will explore the extent of the problem, workable solutions, and the philanthropic approach to working with agencies to improve economic security. We are very pleased to have with us three experts in this field who are going to guide us through this. Ramsey Alwin is the Director of Thought Leadership in the Financial Resilience Team at AARP. Roz Quarto is the Executive Director of Empowering and Strengthening Ohio's People. And Naomi Stanhouse is a program consultant with the Retirement Research Foundation. We welcome all of you. Ramsey, let's begin with you. Please set the stage by sharing the extent of the lack of economic security and the consequences for older people.
Wonderful. Thanks, John, and thanks to Grantmakers and Aging for covering this extremely important topic that is only, unfortunately, growing the needs and the scope of the issue. Before I dig in and share some data that will paint a picture of the reality that we're working with, I want to start with a few headlines that I just picked up surfing the web that speak to the tone that's set generally in terms of older adults within mainstream media. So a few headlines from the Wall Street Journal: retirees aren't headed for the poorhouse. From the LA Times: are America's seniors secretly rich? From Yahoo News: 3 reasons why retirees may not be doomed after all. And then from a local paper: is the retirement gap real or just a political construction? So I share some of those timely headlines with you to illustrate that there's a widely accepted assumption that the golden years are just that, golden, that retirees have plenty of resources to work with due to the important role of Social Security and Medicare, that they are just fine. Today we're going to look at the economic realities and shine a light on what's really going on as people struggle to make ends meet later in life. Next slide. So unfortunately, the reality is these important programs, Social Security and Medicare, do provide a foundation, but given the economic trends, there's increasing vulnerability for all as they age. Almost 60% of older renters and over 30% of homeowners with mortgages spend more than 30% of their income on housing costs, deemed a significant housing burden and hardship. Health expenses account for 14% of Medicare households' budgets and only growing. This is compared to non-Medicare households that are typically spending about 7%. And then, of course, in addition to increasing housing and health care costs that older adults experience, they are very vulnerable to fraud and exploitation. A recent Consumer Financial Protection Bureau released just a few weeks ago shared data from different research sources which demonstrated that anywhere from $3 billion to $30 billion are lost by the 60-plus cohort each year due to fraud and exploitation. Continue. That increasing vulnerability is experienced by all, but there are some true disparities when we begin to disaggregate and look at the true economic reality that older adults face. And we peel back a layer and see the golden years are not so golden for far too many. 3 million households 65 and older experienced food insecurity. 6.4 million older Americans had income below the federal poverty measure in 2014. Almost 50% of single older adults age 65 and older depended on Social Security for 90% or more of their income. And in a moment, we'll look at the important reality that that creates when relying solely upon Social Security, which was never intended to be the one and only source of revenue in retirement. Social Security typically provides about 50% of the income needed to make ends meet in using a bare-bones measure of basic needs created by Wider Opportunities for Women and the University of Massachusetts Gerontology Institute. Over 60% of households headed by an older adult, 60 and older, had some form of debt. As they're juggling to make basic ends meet, they're balancing the books on the plastic safety net. Those credit cards come out, and the total median debt for older adults was over $40,000 in 2013 and only continuing to grow. Half of all individuals enrolled in Medicare had income less than $23,500 in 2015, according to the Kaiser Family Foundation. That's equivalent to about 200% of the poverty measure. And then according to the National Council on Aging's definition of vulnerable individuals, over 25 million Americans 60-plus are living one crisis away from poverty. Next slide. These are cold, hard facts that illustrate the economic reality of older adults struggling to make ends meet. Most of the conversation about older adults struggling is often benchmarked against the federal poverty measure. More recently, there's been an introduction of a supplemental poverty measure, a true game changer. The traditional federal poverty measure looks at the cost of food and multiplies it times 3. The introduction of a supplemental poverty measure by the United States Census Bureau allows us to take a clearer look at what it really means to age with limited income. This new supplemental poverty measure that was implemented just a few years ago has allowed us to look at the out-of-pocket health care costs. And when we look at the poverty rates for older adults 65 plus and take into account the cost of health care expenses, true health security, Medigap coverage, out-of-pockets, premiums, copays, we see a considerable increase from the official poverty measure of about 9% to almost 15% of older adults living in poverty when we take into account true out-of-pocket health care expenses, a very important part of the equation. But that's not all that needs to be considered when we look at individuals struggling to make ends meet. Next slide. When we look at this basic poverty measure and look at the different demographic groups and the implications of living on a fixed income, a picture begins to develop. Twice as many women as men live in poverty, and the numbers of women living in extreme poverty has increased by 20% since 2011. Communities of color are disproportionately aging into poverty, especially women of color. The supplemental poverty measure for blacks and Latino older adults was more than double that of white older adults. This is a very important point. When we talk about the economic security of older adults, we must disaggregate, look at race, gender, look at geography in order to get a closer, better, clearer, crisper understanding of the economic realities before we begin to craft solutions. The share of seniors living in poverty is larger in every state under this new supplemental poverty measure that better takes into account out-of-pocket health care costs. If you look at the examples I've shared, the official poverty measure demonstrates a much lower population in need in each of these states. But once the supplemental poverty measure is applied, you see in California, 21% of older adults falling short of basic needs, 14% in Connecticut, In Hawaii, Indiana, Massachusetts, Maryland, Nevada, New Hampshire, and New Jersey, there's a doubling of elder poverty when the supplemental poverty measure is applied and true out-of-pocket health care costs are considered. Layer into that the reality that every day 10,000 people in America turn 65. If the current poverty rate of 15%, according to the supplemental poverty measure, holds, that means there'll be more than 11 million older adults living in poverty by 2020. Next slide. Now, that's a poverty measure that we're talking about. As the National Council on Aging has taught us all, there's more to the story than those living in poverty. There are those living on the edge, one crisis away from plummeting into poverty. The Wider Opportunities for Women UMass Boston Gerontology's Institute has an elder economic security standard that is an important framework to help us think through these economic realities and craft solutions and interventions that can be very holistic in helping move an individual closer to economic stability or economic security. I encourage you to take a look at the basiceconomicsecurity.org website. Look at the geographically based measure of economic need. It's an important tool because, as you'll see, putting in various locations across the country, that the cost of living varies by community. In this slide, I share the U.S. average, Alexandria, Virginia, a suburb of Washington, D.C. area, and Wichita County in Kansas. You can see how the cost of housing varies by location, the cost of transportation, the cost of health care. A big surprise for many is that the cost of true health security, Medicare supplemental coverage, out-of-pocket premiums, copays, is far larger than anyone anticipates going into retirement. Almost over $400 a month is what the Elder Index shows us. When you aggregate the cost of housing, food, transportation, healthcare, miscellaneous, you come up with the cost of what it takes to make ends meet. We'll look at the U.S. average in particular of over $23,000 annually, but contrast that with Alexandria, $30,000 annually, and Wichita County, Kansas, $21,000 annually. Makes you pause and think about where you may want to retire. Next slide. The importance of the Elder Index is that it gives you a compass. It allows you to think through where you're going and how you're trying to help an older adult, whether it be policy, program, product, service. If you know the goal, you want to help them achieve economic security and what that number looks like, you can then begin to line up the programs and the supports to help get them on a path. When we look at the average Social Security income of a woman, about $13,000, and the true cost of making ends meet, bare bones, no extras there, Blockbuster or gifts for the grandchildren, just the basic housing, health, transportation, food costs of an older adult renting a one-bedroom, she only has about half of what she needs when living on Social Security alone. Even median retirement income for men and women is not enough. So I really encourage you to think through, as you're considering strategies, how using an Elder Index to illustrate the gap and helping identify the different solutions and interventions in order to fill that gap, and how this Elder Index can be a tool to do so. Next slide. In closing, because I just have a few minutes, but I do welcome questions later in the program, I'd like to share that by any index, by any measure, there are key target groups that are living, that are more vulnerable when it comes to their economic circumstance. Individuals 75 and older, the older, are by any measure more vulnerable of outliving any savings they may have had. Communities of color, women, individuals living alone, and of course individuals with hardship costs exceeding 30% of housing expenses, or individuals experiencing hardship due to housing costs that exceed 30% of their income. So in summary, that's just a sense of how some of the different measures can help us determine the scope of the problem, which unfortunately is ever increasing. And I look forward to a discussion today about important holistic solutions.
Well, thank you so much, Ramsey. This is important and sobering information for us to get started with. Before we move on, I want to remind you of two things. One is that if you're interested in the slides that we're using today, they're available to you if you go to the the box on the right side of your screen. At the bottom, there is a chat function, so you open that up and you will see the URL to access the slides. Also, we will be having questions for our speakers later because there's a large audience on with us today. You will need to type your questions. So in the same box, if you open the question box rather than the chat box, you can start typing your questions at any point, and we will turn to those later. So Roz, let's bring you in. Please share how the approaches your agency has taken to help older people, older adults, and the lessons that you've learned from this process.
Great. Thanks so much for having me. I'm really thrilled to be sharing some of the lessons we've learned. Next slide, please. Empowering and Strengthening Ohio's People is a HUD-approved housing and financial counseling agency. At one point in time, during the heart of the foreclosure crisis, we were Ohio's largest foreclosure prevention agency. Next slide, please. In 2012, we noticed that more than 40% of our clients were 55 and older. At a point when people should not even be having mortgages, we were looking at a group facing foreclosure and losing homes that had been in their families for decades. So what we did was we were able to get a grant in 2013, an organizing grant, to start to hold listening tables and ask seniors, what are your financial issues? What are your banking issues? What are the needs that aren't being met? And as a result of that, in 2014, we launched the Senior Financial Empowerment Initiative. Next slide. The purpose of the Senior Financial Empowerment Initiative is to help seniors age in place with greater financial security. The initiative consists of 6 programs at this point in time: financial education workshops, financial coaching and counseling, foreclosure prevention, a senior property tax loan program, benefits assessments, and free tax preparation and filing services. Next slide, please. But that's not how we look at it. We look at it in this slide, and this is how we approach the everything that we do. We have created what we think of as a robust suite of fully integrated services. A senior can enter into our programs at any point in the cycle and have access to all of our programming. But right in the middle, our senior workshops, that is our primary point of entry. Next slide, please. We have 6 modules, so we have 6 workshops that we will hold at every place that we go. So, for example, if we're at a senior center, we'll go to the same senior center every Monday for 6 weeks. We made a decision very early on not to develop our own curriculum, but to use evidence-based curriculums that were already been developed by people much smarter than we are. And so our first module is understanding, identifying, and avoiding elder financial exploitation and abuse. And then our second module is preparing for the unexpected. Those are both based on the Money Smart for Older Adults curriculum put out from the CFPB in consultation with the FDIC. Then our last 4 modules are goal setting, budgeting, understanding credit and debt, and building savings. And for that, we use AARP's fabulous Finances 50+ curriculum. I will say this, we love that curriculum, but it's definitely geared more towards younger seniors and seniors, older adults that are still in the workforce. So while we do use that curriculum, because our clients tend to be much older, primarily out of the workforce already, and mostly in the bottom quartile of income, we do have to make some adjustments. Next page, please. Our goal is has always been to convert 10% of our workshop attendees into coaching or counseling clients. We get better at that every year. This year so far, our conversion rate is about 30%. Now, for those of you that are unfamiliar with these these 2 things, they're a little bit different. Counseling is crisis-oriented and very counselor-directed, whereas coaching is goal-oriented and client-directed. So as you might imagine, when you're dealing with older adults, unless there's an immediate crisis, the coaching modality is much preferred because you're dealing with somebody who has life experience and should be participating in setting their own goals and directing how they want to get there. Despite that, we still have baseline goals that we measure. So our baseline goals are, with each client, we'd like to see at least a 10% reduction in debt, a 10% increase in savings, and a 50-point increase in credit score. The hope is that if they're able to reach those baseline metrics, then there are more conventional, affordable products available to them. For example, instead of having to go to payday lenders, if they end up having that one crisis that could turn them into being part of those poverty numbers that we were just talking about. Next slide, please. For our coaching program, we use actually a computerized 12-month session called My Budget Coach. These use best practices to teach basic budgeting and financial wellness and really develop financial capabilities in our older adults. Certainly with some of our older adults, the computer can be a little bit daunting, and our coaches will work one-on-one with them in person if the computer becomes too daunting for them. Once a client goes through our 12-month coaching sessions, they have free access for life to the budgeting program, which we've been told by most of the older adults that use it has absolutely changed their life and how they deal with money. Next slide, please. As I mentioned earlier, we started out as a foreclosure prevention agency, and because this program is about helping seniors age in place, we still have to engage, unfortunately, in foreclosure prevention counseling. Today, in Cleveland alone, more than 41% of senior homeowners remain underwater. For those that don't know what that means that almost half of our senior homeowners owe more money than their houses are worth. And that doesn't even talk about the age of their homes and the disrepair that many of them are in. Often, many of these houses have only bathrooms on one floor, but their kitchens are on a different floor. Very difficult here in Cleveland. Nationally, 70% of homeowners 50 to 64 and 40% of homeowners 65 and over are still paying a mortgage. This is not the American dream the way we were sold when we were kids, and these are not golden years for way too many people. Next slide, please. One of the programs that we were able to develop thanks to an invitation to the Clinton Global Initiative was to develop a senior property tax loan program. The next foreclosure crisis that's hitting the United States is older adults who can't pay their real estate taxes. As of today, when this day started, there were more than 7,000 seniors in Cuyahoga County alone that are at risk of foreclosure due to unpaid property taxes. And those are people who even have partial tax abatements. Cuyahoga County is where Cleveland is. Through our commitment to action at the Clinton Global Initiative, we were able to develop a private-public partnership, and we raised $200,000 to develop a small loan program for seniors 55 and older. The loans start as low as $500 going up to $6,500 at a 10% interest rate for over 3 years. Anybody who qualifies for a loan that we'll give a loan to has to engage in mandatory financial coaching. At this point, we're about a year and a half into the program, and we have a 100% repayment rate and a 100% active coaching engagement. So clearly there's a need, and clearly the older adults are responding well to this program. Next page. We also do benefits assessments, helping older adults access critical income supports. Our counselors will assist clients in identifying and applying for federal, state, and local benefits. Our average client is making less than $14,000 a year in income, and most of our clients' full incomes are Social Security. So every bit helps when we can access additional income for them. Next page, please. We also became a free VITA income tax preparation site. We are a year-round site, which is very rare in the state of Ohio. Most are only open from January to April, but we all know that tax issues, don't go away on April 16th. And so we are here to develop long-term relationships with our clients, and we use our income tax site as a teachable moment. We try and capitalize on that moment when our clients are getting refunds. We were able to raise some money from a national bank, actually, to create a matched savings account. So for every dollar that an older adult will put from their refund into a bank account, we will match it dollar for dollar up to $500. So basically, like with all our services, we try and use this as a gateway into wraparound services. Working with the older adult population is very difficult, and it takes a long time to build trust. And so all of our programs are year-round and are connected with one another so that we can build that rapport with the seniors. Next page, please. This is obviously a very long slide. I'm going to just give you the basics of it. Betty is a typical client. Betty was 62. She was looking forward to retirement, was doing everything right, wasn't making a lot of money, but certainly enough to live on and retire on, when her company cut her hours. Then her house fell into disrepair, and she had to make difficult choices. Because of those difficult choices, she got behind in her property taxes and then got threats of foreclosure for her property taxes, and on top of that started to get penalties assessed. We were able to give her a loan and have her actively engaged in My Budget Coach. And in her own words, ESOP has changed her way of thinking about money, and she feels confident again that she will be able to retire in 3 more years with some sense of financial security. Another typical client we had came to us with a $300 a month deficit. And in a very short order, our counselors were able to see where he had money being stolen from him from something that happened 30 years before and had been written off his credit report. And we were able to turn that $300 a month deficit into a $500 a month surplus, changing this man's life. Next page. So for us, we basically came from the housing arena and moved into the senior arena. And in bridging those sectors, and for programs like this to work, we have to collaborate. Agencies like area agencies on aging have to start working with housing agencies and have to start working with funders to deal with these problems. They're multifaceted problems, and we have to hit them from all directions. Next slide. So this slide is one of my favorite because it's not really correct. Thinking outside the box is really not enough. What we need to do is throw away the box and rethink this whole problem and rethink philanthropy. A lot of the philanthropy that works with seniors are working with older adults and health issues. And we need to start looking at the bigger picture and educate traditional funders in the senior realm on how important it is to work on financial capabilities issues. We have to, teach our clients to fish and not just give them fish, or we're going to have bigger problems than we already have. Next page. And this is just a quick slide, and it's actually my last slide, to show in a very short amount of time the amount of the rapid growth and the need. In 2016, we are already seeing that we're going to surpass doing more than 300 workshops. We're going to have more than 3,000 attendees, more than 300 seniors in coaching, $100,000 of new tax loans put out there, over 500 seniors who have are filing their taxes with us. I think we actually hit 800 already. And we already spent all our money on our matching fund account. So, and we're just a small agency in Northeast Ohio. So the numbers are just staggering. The need is staggering. And And I think that there are a lot of new programs developing, and if we can get the agencies and philanthropy on the same page, we can have an opportunity to really save some lives.
Well, thanks so much, Roz, for that wonderful information, very detailed information about programs that really work and are meeting the needs in your local area, as you say. And we'll have time for questions once again. Remember that if you'd like to ask questions, you need to open the question box, which is on the panel at your right, at the right hand of your screen, and type in your questions. We'll be answering those questions right after the final presentation, which is coming up. So Naomi, let's bring you in, representing the funding community. Please tell us why the Retirement Research Foundation has identified economic security as a priority, and give us some ideas for other grant makers interested in getting involved in supporting economic security for older adults.
Okay, thank you, John. Let me put up the first slide and go right to the first slide. So can you go to the next slide? The mission of the Retirement Research Foundation is to improve the quality of life for our nation's elders, and we are one of the first private foundations devoted exclusively to aging and retirement issues. A note about our name, it's a bit of a misnomer in that we're not a foundation that focuses only on research about retirement. We fund a variety of direct services, training of professionals and paraprofessionals, support clinical and policy research, as well as collective advocacy for system reform. One of our primary concerns is for older adults who are in economic distress. We invest in economic security because it is fundamental to an older person's well-being. But we define economic security broadly as access to the assets, income, and community-based supports necessary to provide for basic human needs such as housing, health care, nutrition, transportation, household essentials, and long-term care if necessary. Promoting retirement security has been at the heart of our grant making from our inception more than 35 years ago. As you heard from Ramsey, retirement insecurity is on the rise as more of the middle class falls behind. Many seniors have not recovered from the Great Recession, and consumer debt is mounting. The Retirement Research Foundation has supported many different strategies to promote economic security, and we focused on many components of the retirement system, from Social Security to work in the pension area and on individual retirement savings. I want to share some examples today because many funders steer clear of supporting work around economic security because they cannot find ways to bite off manageable pieces. And I'm always glad to talk with any funder about opportunities to support retirement security. So today, can you go to the next slide? Today, I want to talk about 4 investment strategies that the foundation uses to advance economic security of older people. Can you go to the next slide? The first is RRF provides funds to build the capacity of service providers and consumers to implement individualized economic action plans. This means support for the development of usable tools or resources, for training providers to help consumers use the tools, and for support for direct services such as economic casework. I'm going to give a few examples. I may have to skip over some in the name of time. From 2011 to 2014, the foundation made its largest ever grant, $1.125 million over 3 years, to the National Council on Aging in support of its economic security initiative. The foundation's funds helped advance and improve the model of economic casework, where providers help older adults assess their financial situation and implement an individually tailored action plan to improve their economic well-being. One of the principal components the foundation funded was the development and testing of an online tool known as Economic Checkup. I hope you've all tried it and use it. During a 2-year tracking period, the use of the tools and the economic casework approach helped 5,000 seniors achieve, on average, $3,000 worth of benefits and savings. While this may not seem like a lot, it's equal to almost 25% of the average monthly Social Security check and means the difference in purchasing medications and other essentials. Funders like to be able to determine their return on investment. $1 for every $15 in return, an aggregate of $15 million, I'll take it. This was an easy one to calculate, and the return will continue to increase as the tools become more widely used. On a much smaller scale during this time period, the Foundation also made a modest $25,000 grant to one of the aging services providers that was participating in the pilot of the economic casework approach. So I want to emphasize that grants of any size can find their way to support economic security of older adults. Just 2 months ago, the Foundation invested in expansion of the use of the economic checkup tool beyond the Aging Services Network. A 2-year, $300,000 grant was made to enable GreenPath to train its staff to use the economic casework approach and economic checkup tools. GreenPath is a highly respected national nonprofit financial counseling and education organization that provides housing counseling, debt management, bankruptcy counseling, financial counseling, and budgeting to 200,000 households annually. Close to 90% of its counseling is done by telephone. The Foundation's grant will help the National Council on Aging and GreenPath develop a national telecounseling model to assist older adults with financial security issues, including money management, budgeting, debt management, and housing counseling. Next slide, please. Our second investment strategy involves advocacy to protect and ensure sensible reform of social insurance programs such as Social Security and Medicare. For older persons at the lowest economic levels, reliance is always going to be on Social Security. As we rev up for inevitable and necessary reforms to shore up Social Security, the Foundation has been investing in advocacy from a few perspectives: to better prepare older adults themselves to engage effectively in the debate, to fund research that will drive sensible reform, and to educate seniors on optimizing their benefits. We've made 2 grants of $80,000 each to the Social Security Works Education Fund. This is one of the nation's leading organizations informing policymakers and the media about retirement security for older adults, particularly issues surrounding Social Security. Its skill-building program guides participants in an interactive exercise to become confident spokespeople. With the Foundation's funding, Social Security Works is training the staff and volunteers of the Alliance for Retired Americans to tell their retirement income security stories more effectively and get their messages out to the media. The Alliance is a nonprofit grassroots advocacy organization with 33 state chapters and 1,600 affiliates. It represents more than 4 million retirees. A second RF grant focuses more on data than on bolstering personal stories. A 2-year, $190,000 grant was made last year to the National Committee to Preserve Social Security and Medicare. This is the organization that the Wall Street Journal calls the group with one of the best reputations for fielding Social Security questions. The committee is conducting research on the effects on local communities that may result from proposed changes to Social Security and Medicare. This is the first large-scale project to document the impact on local economies, estimating the value added for local communities as Social Security recipients spend their monthly checks. Economists refer to this impact as the multiplier effect. While this has been done for states and the nation, this is the first look at the county and congressional district level. The study will apply liberal, moderate, and conservative multipliers to economic data from each locality and report all 3 sets of numbers. Since we know that all politics is local and legislators do focus on their own communities, this could be groundbreaking and compelling data that could help protect programs like Social Security and Medicare. A third advocacy education grant was made to the National Academy of Social Insurance, a nonprofit membership organization comprising the nation's leading experts on social insurance. NACI received grants of $65,000 and $75,000 to educate lower-income older workers about the advantages of working longer when possible to delay receiving Social Security retirement benefits. Go find on NACI's website the When to Take Social Security, It Pays to Wait toolkit. It has videos, fact sheets, and briefs that are concise and easy to use, and both funders, advocates, nonprofit organizations might find these useful tools. Next slide, please. Many of today's retirees still receive defined benefits, although they are on the decline for future generations. Advocating for pension rights and protections for these retirees is very important. Many benefits go unclaimed as plans are lost or plans are calculated wrong. The Foundation has invested in the Pension Rights Center, one of the principal national advocacy organizations that protects pensioners' rights. PRC is the National Trainer and Technical Support Organization for a network of 7 pension counseling centers that cover 29 states. These centers provide individual advocacy for individuals who may have trouble finding a pension when their company moved or merged. Annually, these centers work on nearly 4,000 cases and recover more than $11 million in pension benefits. The foundation awarded the Pension Rights Center a total of $225,000 over 3 years as a match for its federal grant. In addition, the foundation has provided 4 years of support for the Illinois Pension Counseling Project, as Illinois was one of the states not covered by the other centers. For any funder, again, interested in quantifying a return on investment, this is an easy one to do so. Next slide, please. The fourth investment strategy focuses on promoting individual retirement savings. About half of American workers lack access to any sort of pension or retirement savings plan. 5 groups, employees of small businesses, young workers, low-income workers, minorities, and women, are most likely to be without coverage. Lacking any federal action, states are developing options for these workers to have easier and cheaper access to retirement plans. Illinois is the furthest along, having enacted into law the Secure Choice Savings Program, but at least half of all states are looking into setting up such programs. So here there is ample opportunity to invest in the research, advocacy, and education around this movement. The foundation has invested heavily in state-based universal retirement savings programs. Beginning in 2012, we began investing in a collaborative advocacy effort that led to the enactment of Secure Choice. By mid-2017, Illinois workers will have an opportunity to be automatically enrolled in an individual retirement account and will contribute 3% of their paychecks. They may change their contributions and opt out at any time. Secure Choice will be a requirement for all Illinois businesses that have been in operation for at least 2 years, employ 25 or more workers in the state, and do not offer any other type of pension or retirement savings vehicle. The program could potentially benefit 2 million Illinois private sector workers. While this program will not be of much value to today's retirees or even near retirees, it should help future retirees improve their economic security. Toward this effort, we've made 3 types of grants. We funded a research study to Woodstock Institute that showed Illinois legislators the number of workers in their districts that could benefit from such a program and the economic impact on their communities. We funded an education campaign targeting small businesses, and we funded the Sergeant Shriver Center on Poverty Law in partnership with Heartland Alliance, which has been providing technical assistance to the state, monitoring this initial implementation phase, and educating consumers about the program. Next slide, please. From the examples I've shared, I hope that if you are a funder, you will come away with a greater interest in supporting efforts to improve economic security for older adults and an appreciation for the many different types of approaches that your investment could take, small or large, from direct service to advocacy to policy reform. It is possible to move the needle for individuals as well as affect change in policy to improve the economic well-being of older adults. Next slide, please. Last, I just want to share some information on some organizations and their websites where you can learn more about the economic security challenges of older adults and ways they can be effectively addressed. Thank you for the opportunity to share our story.
Thank you so much, Naomi. This is very important information about how funders can work at the high level or at the smaller level, and those are all very important suggestions. At this point, we want to turn to your questions. I want to answer a couple of the questions that keep coming up before. Once again, if you're interested in the slides, which have a lot of wonderful information, go to the chat box, not the question box, but the chat box, which is the last one on your control panel, and open that up, and you will see a URL that will take you to the slides. Also, we will be making this whole webinar available later as a rebroadcast. Watch our website, giaging.org, or we usually put those out in our newsletter as well. At this point, let's turn to your questions. I'm going to start with you, Ramsey, and this is a question about, particularly about rural areas. So someone's asking about interventions or evidence-based practices that could be implemented in areas that have high poverty levels, as rural areas often do, talking about a county that has 31% of older people living in poverty now. So could you talk a little bit about the lens of rural aging and the impact that that has as well?
Sure, absolutely. An essential vulnerable population is those that are isolated. That isolation can be many things. It can be isolated from social connections and living in an urban area, or it could be literal isolation living in a rural location, and there is an increasing growing challenge in rural locations. I think what's key is looking at holistic strategies and conducting asset-based community mapping exercises in any community to look at the existing resources, look at how complementary organizations might better coordinate their efforts and streamline their efforts and look at innovative, new and different ways of reaching their population. So and rural communities have been doing this for decades. It's just the economic reality that they need to better coordinate their service delivery given limited resources and geography. And so when looking at strategies to help older adults, using a community resource mapping exercise to identify the pockets of activity that could be leveraged and could be better coordinated, whether it be mobile units that are already going into certain communities, providing meals, or flu shots being leveraged and expanded to include an economic checkup screening or tax assistance, so that we're providing very holistic, comprehensive services whenever making that touch point with an older adult. But also, as Naomi mentioned, with one of the impressive investments the Retirement Research Foundation has made in NCOA and GreenPath, telecounsel is really an essential strategy when working with older adults, regardless of geographic location, given mobility and economic challenges. Often starting the conversation on the phone it can be a gateway to engaging them than in person as well.
Well, thanks. Roz, here's a question for you. Actually, there's a couple of our audience today that wants your agency just to move to where they are so you can start providing your services to them. But obviously, as you say, holding all these pieces together, you are a housing provider and then moving into a very wide array of services here. What do you think are the most important lessons you learned about building that coalition? Is there some place in particular people should start, or is it just finding people that will work with you, or how did that work for you?
You know, I'm gonna be honest. I think that it was very much whoever would start talking to us first is who we started talking to. To switch from housing to income insecurity issues, you know, counseling is counseling, coaching is coaching, and it's just a matter of being able to, you know, look at the bigger picture. But I would start with the senior serving agencies that are already touching the people you want to touch, and start to convince them about integrating these other services. So, for example, in Cleveland, the Benjamin Rose Institute on Aging, they do a lot of great policy work. They do a lot of caretaker work. They do continuing ed, but they were never dealing with these issues. And so we have found numerous ways to work with them. And then they acquired some centers, some community centers. And so now we are actively engaged with them in all of their community centers. So I would really recommend looking at agencies that are touching the population that you want and explaining how when you can work on these financial issues, the other issues are all included: better health indicators, less food insecurity, etc.
Well, thanks. Naomi, let's turn to the funder issues for a minute. A couple of questions around this. Certainly some frustration being expressed with how difficult it is to find philanthropic funding for these programs. Could you tell us a little bit more in terms of if people are looking for funding for these programs, what are some things that you would suggest are essential pieces, knowing that every foundation or funder is going to be different?
Yeah, true. You meet one funder, you meet one funder. We have the same frustration in that we look for funding partners all the time. I mean, I think if you're approaching a funder who's at least somewhat in the space of families, in which an older person is certainly, within the family, you have to take the lens of the funder. But, if you look at families and then you begin to address the myths, as Ramsey started very early on, talking about the fact that these are not the golden years but the plastic years for older people. So first of all, it's educating funders as to exactly that this really is an issue. But then looking at the space they're in and relating that to older people, whether, if they're in a family situation or if they're dealing with the workforce issues, and you can see that it may not be an issue for economic security for older adults, but it might be for workers who are going to become older adults. If you look at economic issues as intergenerational, for housing, for resource transfer, et cetera, you can make a case. You just have to look at the lens of the aging of the funder you're talking to.
Well, thanks. Ramsey, I'm going to come back to you because we're going to go right back to where you started, which is the headlines in the news about the positive economic aspects of aging for some folks. And the question is really around that there have been recent studies and so forth talking about that the economic impact of older people in a community is often positive, to the degree that, if you had the choice between 1,000 60-year-olds or 65-year-olds and 1,000 30-year-olds, you'd pick the 65-year-olds. I guess the question is around the balance. We all understand that there are some people in extreme poverty. There's also people in the community that are extremely wealthy, and everything in between. How do you, particularly trying to provide advocacy roles here, how do you go about setting up that discussion so that people don't immediately jump to one or the other and think that's what all older people are?
Sure. Well, using measures of economic security can be a powerful framing tool. It's true, there is a business case around an economic stimulus of older adults staying in a community. There's a real case to be made with different community stakeholders to talk about why it's important to keep older adults in their community because they use their resources locally. But those older adults need enough income to meet all of their basic needs. And so that's why I often use WOW's Elder Index to sort of frame the conversation around the true housing costs, the true health care costs when aging. So many assume that Social Security and Medicare will meet all of their needs. But as was pointed out, the rising cost of property taxes, homeowners insurance, utilities, then health care premiums, copays out of pockets, all of this begins to add up when living on a fixed income. So using some tools such as WOW's geographically based measure of elder economic security to begin to define the conversation around what it means for an older adult to live in our community, how much is required based on their health status, their housing status, their household composition, and then talking about the typical income in your community and how people are coming up short and how a growing number of individuals are one crisis away and getting very creative and resourceful in plugging the gap, but how communities can better create systems and supports and coordinate services so that there's less vulnerability there and people can stay in their communities and age as they choose.
Well, thanks. Unfortunately, we're to the end of our time today, and I want to give each of our speakers an opportunity to give their last words of wisdom to us. And Naomi, we will start with you.
Oh, well, I guess it's not words of wisdom, it's just words of encouragement. I would say go for it. There's so much in the economic security space where there are needs for funders at all levels, in all ways, from direct service, as I said, to policy reform, depending what the appetite of your foundation is and the size of your pocketbook. There's a way you can make a difference, and I just highly encourage you to plunge in and call us, email us. We're always willing to share and encourage.
Well, thanks. Roz?
Sure. The financial problems facing seniors of all ages and all economic levels are getting worse. Those in the bottom quartile who subsist primarily on Social Security will need even more help if they're going to be able to age in place and afford even their most basic needs. I hope that the nonprofit community continues to keep thinking outside the box for innovative solutions, and more importantly, I hope the philanthropic community will step up to support innovative and sometimes untested programs at the local level. Not everything can be scaled immediately. It all starts at the local level.
Well, thanks. And Ramsey?
Great. These are changing times. It's an opportunity. I want to leave us on a high note of optimism. I think there's a lot of exciting innovation and piloting of new and different ideas to tackle this ever-increasing challenge that we face. And I encourage and empower everyone to look at the challenge of aging with dignity and decide to own a piece of it, whether it be policy, program, product creation, collaboration, coordination. Find a piece that you can own and begin to chip away so that we can build communities and a society in which we can all age with economic security and dignity.
Well, wonderful final thoughts from our speakers. I want to thank Ramsey Alwin, the Director of Thought Leadership in Financial Resilience at AARP, Roz Quarto, Executive Director, Empowering and Strengthening Ohio's People, and Naomi Stanhouse, who is the Program Consultant for the Retirement Research Foundation, for their participation today. We thank you for all that you do for older adults. I also want to thank Ellen Bruce, a consultant for GIA, who helped us put this session together today. We always thank our friends at the John A. Hartford Foundation, the Retirement Research Foundation, AARP, and Empowering and Strengthening Ohio's People, the sponsors for today's program, for their support. And also to our friends at the American Society on Aging for their technical support in all these programs. We will be making this presentation available to anyone who wishes to view it later, including both the slides and the audio. Watch for a rebroadcast link on our website or contact Grantmakers and Aging at info@giaging.org. Join us on June the 6th for a webinar on the important but often unknown topic of organizations that are supporting survivors of the Holocaust who are obviously becoming older but also have opportunities that they may not know about. So that will be a particularly interesting one on June the 6th. And finally, I want to thank all of you for participating in today's webinar. Have a great day.